We're here at the University of Texas Medical Branch Specialty Care Center, which is in League City, just south of Johnson Space Center. And we're joining today Dr. Roy Riascos, who is one of the many doctors looking at the changes that astronauts experience in their eyesight when they're in space. He in particular has been looking at using MRI to track those changes, and he's going to tell us a little bit about that today. Thanks so much for joining us.
Thank you so much for having me here.
All right, well, why don't we start with, why would you use an MRI to look at eyes?
Well, so MRI is modern technology that allows us to look at the anatomy of the body using magnetism. The eyes are structures that have a lot of fluid in them, and MRI is really good to look at structures that have fluid. Since the astronauts have had problems with their visual fields, MRI now allows us, using modern technology, to have very high resolution imaging of the orbits and of the eyes. We are actually doing scans that go through the eyes of the astronauts that are less than 0.6 millimeters in size, each of the dots that make up for the image. And this will allow us to actually follow and check out things that would happen macroscopically inside of an eye. So, and in the optic nerve that goes behind it.
For those of us who don't know, what exactly is an orbit?
Okay, so basically the face has two big cavities that are to just hold the eyes in, right? So we call those the orbits.
So you've been doing this for a while now. I think you started with the last 3 of the shuttle missions. Have you been able to get some good data from them?
Yes, so we have been using MRI on the astronauts for around 8 years. The new experiment that we started with the VEIP started 5 years ago.
Okay.
And we did the last 3 shuttle missions here, and then all the Soyuz project.
So I guess you've gathered a lot of data. Is it helpful data?
Well, the main thing that we do with the data is we do a clinical read of the MRI, just like we would for the brain of any subject that came into the magnet. The additional information that we get out of the study is being analyzed right now, and it's part of research.
What exactly are you looking for in the data?
So the data that we get from the astronauts, we scan the brains, so we get to see how the brain looks. We also get to scan the orbits, just like we discussed, and the orbits will find how the eye looks and how the optic nerve is. The optic nerve connects the eye with the brain. And then there's a sheath around the optic nerve that we also look at, because we have seen changes in astronauts before and after they come from space, in not only the optic globe, but also in the optic nerve and in the optic nerve sheath.
You're looking at the optic nerve sheath then. Is it getting smaller or bigger?
Some of the astronauts have shown to have a distended optic nerve sheath, and also the optic nerve becomes a little bit more tortuous.
Okay.
At the same time, there's some flattening of the back of the eye, and that is especially true in the ones that have had visual changes.
What exactly does the sheath control?
We really do not know. That is a great question. We know that all of these are a result of changes, possibly of pressures of the whole system. One of the important things to understand is that the eyes are actually not nerves. They're really extensions of the brain.
Okay.
So when the optic nerve sheath distends, it could be also that the pressure inside of the membranes that cover the brain is increasing. So that could be one of the causes of the changes that we are seeing, and we're actually exploring that.
All right, so what exactly is this behind us? This is the MRI, right?
So this is an MRI machine. The MRI machine is what you're seeing here is a huge magnet. So right now this magnet produces 60,000 times the magnetism of the Earth. So we use that to actually align the atoms in the body as the body goes in there. And once we have aligned all the atoms, we choose the atom that is the most frequent one in the whole body, which is hydrogen, right? We then we're able to make all the hydrogen atoms kind of dance to the same magnetic vector because of the huge magnetism. And we kind of tilt that magnetic vector using radio frequencies. We transfer energy to those atoms and they tilt. And once we take the radio frequency out, they want to stand up again to the same magnetic field, and they'll liberate that energy.
Okay.
And then we use basically antennas to detect the energy that's liberated and tweak it a little bit to get an image.
So you get images of the astronauts once before flight and once after, right?
Yes, so we usually do an MRI just before they go into the mission. And we try to put them into the magnet in the first 3 days after they come back to Earth.
Okay.
And the reason to that is we really want to be able to detect changes as soon as they happen before the gravity of Earth changes or reverts any of the changes that could have happened in space.
Have you been able to draw any conclusions from all this?
So far what we have seen is that some of the changes that we have identified in the orbits are similar to changes that we see in terrestrials that have increased intracranial pressure. And that is one of the things that we really want to concentrate our efforts right now, is to make sure, or we want to know what is the cause of all these changes that we have seen in the orbits.
And our goal is to identify countermeasures, right?
And hopefully this could be, yes, this could be related then to, because we transferred to countermeasures that we can take to avoid this from happening again.
Okay. So what do you do with the MRI?
Okay, so with the MRI, what we do is we scan the brain of the astronauts. We scan the brain and we look at the big picture of the brain of the astronauts. That's called the macroscopic brain. At the same time, we are going to scan the orbits. We scan the orbits, and even though we're looking at the orbits in the macro, we use a much higher resolution to look at the orbits. And we can really see very small details. And I was explaining to you last time, those details can be up to 0.6 millimeters in small changes that we can detect with the MRI. But the interesting thing is that with the MRI, we don't only see macroscopic changes. We can also detect microscopic changes of the hydrogen within the brain. So one of the things that we do is we actually diffuse the water molecules within the astronaut's brain by using what we call gradients. And that type of imaging is called diffusion tensor imaging. It will give us information about the microstructure of the brain and the water within the brain, things that we cannot see with our naked eye, but it will actually give us function. And we can map all the fiber tracts within the white matter, and we can see if there are microscopic changes within it. A third great thing that we do is that we're able to also see flows. And by seeing flows, we expect to quantify those flows and possibly be able to have an indirect way of measuring intracranial pressure.
Okay.
So if increased intracranial pressure could be one of the causes of the findings that we're seeing, then through MRI, we expect to be able to have a correlation between the imaging findings through flows and intracranial pressure changes.
So you've seen a lot of astronaut eyes. You want to take a look at mine now?
Sure, why don't you take a seat?
All right.
And Keith will help us out.
Okay.
All right. There you go. Okay. We'll put the head coil on now.
Okay, what is this?
This here is it's a coil. This is basically a fancy antenna that takes the pictures of the inside of your head.
Roller coaster ride.
All right.
So any instructions?
The only instructions at this point are just try your best not to move.
Okay.
Okay, so what we're looking for when we're looking at a patient in a magnet like Brandi, especially when it is an astronaut, is at their brain. Here you can see the head, and in the middle you have the brain. And we can scroll and see all the structures inside of the brain. You can see the white matter and the cortex. We can also see the eyes, and this is especially something very important for this project. And in the eyes, we can look at the eye globes. You can see here the eye globe, and this is the lens inside of the eye. As we scroll down, you can see that the eye is connected posteriorly with the optic nerve. And this structure that we have right surrounding the optic nerve is the optic nerve sheath that we were talking about. Okay, you did a great job, Brandi. Thank you.
Thank you.